I'm going to talk about trout, I'm going to talk about tide, and I'm going to talk about tires. Let's start with trout. Okay, so this is a patient of mine. Well, actually, it's not a patient of mine. Anybody know who that is? Paul Giamatti, yeah. For confidentiality purposes and HIPAA violations, I could not put my patient's picture there, but suffice it to say, he looked a lot like Paul Giamatti. Oh, I learned a good HIPAA joke. Knock, knock. Can't tell you. All right. So Paul is a patient of mine I've been working with 8 to 10 years. He's overweight, he's sedentary, has diabetes type 2, has hypertension, hypercholesterolemia. When we test his hemoglobin A1C, which measures the control of his diabetes, it's usually about 10.2, sometimes after a lot of effort, it's 10.1, and so on. Now, we'd like to have it 8 and below, 7 and below, depending upon his age and other risk factors. It's not good for his brain, it's not good for his heart, it's not good for his kidneys, it's not good for his legs. All right, it's not like I hadn't tried. I mean, I had tried motivational interviewing, brief negotiation, goal setting, couples counseling. I even tried Jewish mother guilt induction. This is a technique I learned at a very young age. I pulled out my quality scores and I said, hemoglobin A1C 10.1, you're pulling down my quality scores. Can you help me out here? If you won't do it for yourself, will you at least do it for me? Nothing was working. Finally, I said to him one day, what do you really enjoy? And I realized I was clueless about that. I had no idea. I could tell you his hemoglobin A1C. I could tell you where he worked. I could tell you how many children he had. I couldn't tell you what he really enjoyed because I thought he was unmotivated. And suddenly his whole face changed. He smiled and he said, trout fishing. I love standing out in the stream, casting. I don't care if I catch anything. I just love being out there. At that moment, and that was 30 seconds, at least 4 or 5 things changed. First of all, I realized that I didn't know this patient. I mean, how could I work with him for 8 to 10 years and not understand something about his whole life apart from his diseases, social history, and so on? Number 2 is I had just done half the screening for depression. Okay, that is, if he would have looked at me and said, there's nothing I enjoy, I cannot think of one thing I enjoy, then you have to think depression and finish the screening for depression. And we all know if the patient's depressed, their likelihood of changing all these behaviors and doing the disease management and so on is very, very unlikely. Third, I now understood that hemoglobin A1C didn't mean anything to him. Trout fishing meant everything. How could I connect hemoglobin A1C with keeping him out in the trout stream doing what he loves to do as long as possible? That became my clinical and communication challenge. And finally, and this is really interesting, you see, I'm in adult medicine practice, primary care, and most of my day is back pain, dizziness, headache, chest pain, mucus, diarrhea, shortness of breath, acting out teenage children. I mean, that's like my day. It's not a real cheery picture, to be honest. And for a moment, when I ask a patient this question, I get to be in a trout stream fishing. For a moment, I get to be repairing children's dolls and donating them to charity. For a moment, I get to be on a playground on a swing with a grandchild. For a moment, I get to be painting a 1967 cherry red Camaro and restoring it to pristine condition. You see, for a moment, it's a bright spot in my day. And it reconnects me with why I went into medicine. You see, I don't want my tombstone to say, he got great quality scores on hemoglobin A1C. That is not my life purpose and meaning. Hemoglobin A1C doesn't mean anything to me. Keeping people healthy with their legs on, with their eyesight and vision, so they can do the things they love and are passionate about, that makes me want to get up in the morning and go to work. So I see this as a way of also connecting passionately with what we are about as a healthcare organization. I had a patient who was hypertensive and was not taking her antihypertensive medications. She knew she had the disease. She actually wanted to take it. That was all clear. She couldn't remember. So what's my usual response? Take your medications, for God's sakes. Number two, provide a tsunami of solutions. Do you brush your teeth every day? Put it next to the toothbrush. Put a note on the refrigerator, and so on. And the patient will sit there and go, yes, doctor, which is the way a patient says no to you. You know, yes, doctor, whatever you say, and then they don't do any of those things. Or I paused for a moment and I said to her, well, it sounds like you really want to take your medications. What do you think might help? Pause. Now, I've learned in the exam room, pausing is not like a life-threatening hemorrhage, okay? But we don't pause. She reflected for a moment to what she thought might work, and she said, Tide. I'll put a note on the Tide box. I do laundry every day. When I go out there, the box will remind me to take my medication. I said, that sounds like a fabulous solution. How confident are you that that'll work? 80 to 90%. I said, that's great. When I see you back, I want to find out how well the Tide solution worked for you. Now, here's a question. How long do you think it would have taken me to come up with the Tide solution? I don't do laundry. I do Windows on a computer. You know, the point is that often patient-generated solutions are much more likely to be successful. If she could have come up with nothing, first of all, screen for depression, okay? Because sometimes they can't come up with anything because things just look hopeless and I can't think of anything. So you screen for depression. And the second thing is you say, well, my patients have come up with some other solutions. Would you like to hear any of them? So I'm not saying that it's all hands off, but it starts with, what do you think might work for you? Discovering their solutions. And finally, celebrate success. So a quick story. I took my car in for service. Nothing was wrong with it. Just needed an oil change. The service attendant walks around my car. He inspects the tires, the rims, and so on. He comes back to me and says, you know, you have done a fabulous job of protecting your tires and rims. At this mileage, I would have expected to see a lot more wear and tear, nicks and scuff, marks on the rims. You've done a great job. Well, I got to tell you, he made me feel really good, okay? He made me feel good. I had done something. He had discovered something I had done that I had been successful in, and he had reinforced it and celebrated it with me. And he had changed my self-identity. Now, when I drive down the road, I'm going, I am a protector of tires and rims. Careful, slow down around that corner. I don't want to wear out that tire. It's a change in conception and a celebration of success. So, how do we engage people in successful change? 3 tips for you. First of all, discover their passions. Find out what they really enjoy. Discover their solutions. That's the starting point. It's not necessarily the end point. And third tip is celebrate the success. You know, the rational part of our brain, and it took me a while to come to the word celebrate, it was acknowledge. Ugh, you know, no guts, no life to it. It was praise, condescending, pretentious. Celebrate is a mutual activity, something you do together in relationship. And so I like celebrate success. And that furthers this success momentum we'll talk about.